This week on Orthoptics TV, we introduce a sweet 7-year-old girl called Charlotte who enters the clinic with her father and is complaining of eye pain. Today we'll examine her eye pressure using the I-CARE Tonometer and explain the indications for use, the preparation and setup, as well as how to get an eye pressure reading. We will also go through the recording and interpretation of the results we obtain and common mistakes that are made when using the I-CARE Tonometer. The intraocular pressure is a measure of the eye's pressure. The IOP measurement is determined using this Goldman equation, and it takes into account an array of different parameters in the eye, including rate of aqueous formation, facility of outflow, and episcleral venous pressure. It is also important to remember that central corneal thickness, or CCT, can have an effect on the IOP measurement. A thick cornea can give a falsely high IOP, and a thin cornea can give a falsely low IOP. So it is also important to have a pachymetry reading in these patients to determine their CCT prior to taking their eye pressure.
Fine, thanks. My name is Zelda. I'm going to be your optometrist today. How can I help you today? We came here for my daughter. She hit her head yesterday, and her left eye was so whole night. Okay, how are you feeling, sweetie? My eyes hurting, and so is my head. Are you seeing clearly, or is now that you hit your head, is it funny? It's a bit fuzzy. So you're seeing blurry? Yes. I can see that your eye is also red.
So the patient has said that after a fall, her eye has been painful. In this case, we want to check her eye pressure so that we can rule out any ocular problems that may have occurred due to the fall. So we generally use the I-CARE when we want a quick and easy measurement for the intraocular pressure, usually on patients who are bedridden or young patients. If we find that a patient is a glaucoma suspect or has ocular hypertension, that's when it would be of extreme importance to have an accurate measurement, which is when we would need to use the Goldman tonometer. Here we've listed patients who are uncooperative like children, or physically disabled patients where we cannot easily set them up in front of the slit lamp to use the gold standard Goldman tonometer. So now, because of Charlotte's age, the orthoptist has decided to use the I-CARE Tonometer.
I'm just going to do a quick routine test to check the pressure of the eye using this machine. Okay, thanks.
So what we'll be discussing in this next video are the different parts of the I-CARE Tonometer. The orthoptist here is demonstrating the measurement button, which is also used to turn on the tonometer. Second is the selector button. Third is the display area. This is the forehead support, and this is the adjustment wheel, which is used to adjust the forehead support so the tip of the probe is placed at 90 degrees to the front of the eye. That is where the probe is inserted. Here is a central groove. This is where the clinician's hand should hold the machine. This is the battery compartment. And the wrist strap is important to secure the handheld I-CARE tonometer. This is how the probe comes. We should open this and insert it into the probe base. In this next video, it is important to note that the I-CARE tonometer should never be pointed down once the probe is inserted. This is to avoid the probe falling out. It is also important for the clinician to maintain hygiene and sanitize their hands prior to this setup. The measurement button is pressed to switch on the I-CARE tonometer. The selector button is then pressed. We should then wait for the load sign to appear. The orthoptist opens the lid of the disposable package that the probe is located in and then inserts the end of the probe, or the shiny, pointy end, into the probe base. It is important here that the clinician does not touch the white tip of the probe in order to avoid contaminating it. The orthoptist then presses the measurement button again, and at this point it is safe to point the I-CARE downwards. They wait for the display screen to show 0.0 and then the I-CARE is ready to take a measurement. In order to take an accurate measurement, the patient should be set up as follows. They should sit up straight with their eyes kept open and advised to look straight ahead. The clinician should then set up the forehead support so that the I-CARE probe tip is at 90 degrees to the front of the eye. It is also important to remember here that the patient does not require anesthetic drops due to the quick and painless nature of the I-CARE tonometer.
I'm going to just get you to sit up straight and look straight ahead for me.
Due to the quick nature of the process, I will explain it now prior to the video. The forehead support should rest on the patient's forehead and the probe tip should be at 90 degrees. The orthoptist then presses the selector button 6 times and will hear a single beep each time the orthoptist presses it. Once the I-CARE tonometer has taken its intraocular pressure measurement, it will give one long beep. When any error is made, the machine will make a double beep. I'll discuss this and demonstrate it a little later on in the video. Here is a closer look at the process. You will see the probe come in and out quickly as it makes contact with the eye. Here is an image of the result that was obtained on Charlotte's eye. 10 mm of mercury, or 10 mmHg. Normal IOP values should be between the values of 10 and 21 mmHg, so Charlotte's results for her intraocular pressure are within normal limits. Once a result is obtained, it is also important to look at the markings on the display area of the I-CARE tonometer. The I-CARE reading shown previously had no markings next to the P and the P was not flashing. This indicates a good result and that the standard deviation between each measurement was relatively small. This makes the result reliable. Each time the orthoptist presses the selector button, it takes a measurement, so overall 6 measurements are taken. If the difference between these results is too large, then the machine will tell you this via little dashes that appear next to the P. We want the standard deviations between each result to be small so that the measurement is reliable and repeatable. If there is a dash shown next to the bottom of the P, then the result is relatively reliable and the standard deviations between each result is relatively small. If the dash is in the middle or near the top of the P, then the difference between the results is high and another measurement should be taken. This can ensure repeatability and accuracy of the measurement. There are 2 ways to record an IOP measurement using the I-CARE tonometer. These are demonstrated here. In the box is the template that is normally used when recording using an I-CARE tonometer, and in the top left-hand corner is another example of how to record a measurement with the T recording. We must indicate that we use an I-CARE tonometer here, as it will be unclear as to which method was used to obtain the measurement. The more commonly used method of recording is the I, which stands for I-CARE tonometer. In this case, it is not necessary to write I-CARE next to it. We record the results with the left eye on the left side and the right eye on the right side in order to minimize confusion. It is also important to note that we do not need to write mmHg next to the numbers. Now, because we are interested in Charlotte's left eye, we record the results obtained from that as per the template. It is also important to write the time of the day in our recordings. This is due to diurnal variation. Diurnal variation means that the IOP shows fluctuations at different times of the day. In a healthy individual, IOP is found to be highest in the morning and lowest late at night. These diurnal variations are due to aqueous humor production in the eye. Other factors that can have an influence on an IOP measurement, aside from diurnal variation, include body posture, where it has been found that patients who are lying down show a 1 to 2 mmHg increase in IOP, if not more. Squeezing the eyes shut or extreme eye movements can be shown to increase IOP in the short term as well. The Valsalva maneuver is when a patient attempts a forceful exhalation of air against a closed airway, usually performed to unblock ears by pinching the nose and closing the mouth while attempting to exhale forcefully. So now back to Charlotte's results. Her IOP or intraocular pressure was found to be at 10 mmHg at approximately midday, which is within normal limits. The normal limits are between 10 and 21 mmHg. So based on this tonometry measurement, amongst other measurements, Charlotte's fall has had no significant effect on her eyes or her eyesight.
I've done all the tests The results came out normal. So as her pressure. So the pressure of the eye, which I was worried about, came out normal, within the normal limit. So now you are free to go. There's nothing to worry about. Just keep an eye on her, and if there's any change in her vision, please return her back.
Here are some of the advantages and disadvantages of using the I-CARE tonometer. Some of the advantages include the fact that it's quick and easy to use, no calibration is required prior to use, no anesthetic drops are needed, and is quite comfortable for the patient. Some of the disadvantages include the fact that the I-CARE tonometer can under or overestimate the intraocular pressure. It is not the gold standard Goldman applanation tonometry, and it is quite easy to misalign, as you'll see in the common errors in the next slide. Here are some of the error readings that we can get while using an I-CARE tonometer and the ways to fix these errors. We can also get a BATT reading, and this means that the batteries are low and should be changed. When the machine detects these errors, it will make a double beep sound. This next clip is an example of a blinky patient, which can cause an error like E05 or E06. Make sure you listen for the double beep, which indicates the error. Let's listen to that double beep again. It is super important to take an accurate intraocular pressure measurement, as it can indicate whether a patient is a glaucoma suspect or has ocular hypertension. Here are the references that were used throughout this video. Thanks from the team at Orthoptics TV.